Hello. Yes, sir. Okay. Thank you, Harish. Good evening, doctors. Myself, I am Dipin Verma. I'm the director in OK Life Sciences. I also extend my warm wishes and welcome you all for this first advisory board meeting on cannabis. As my colleague has rightly mentioned, this is a series of meetings that we are doing across the country, and we have taken the major metros and the thought leaders, in the and the top minds in this fraternity, who can share lots of insights in how we can, help the patients in management of pain with the help of this medical cannabis, which is a new emerging now and getting more legalized. Okay. So, so before we start the deliberations, I just will take few minutes to briefly tell you about what the company is all about and what is overall, what it's doing and from where it all started. So, Innovcare Life Sciences, is basically a research evidence results based company, which is based in Mumbai, and we are pioneer in introducing first time in India products. We we always come out with something by more than 25,000 healthcare professionals across the country, and there are millions of happy consumers or the patients, who have benefited from our innovative healthcare solutions. We follow strict guidelines as far as the WHO GMP standards are concerned. We get our products manufactured which are ISO 9000 registered. We have the full safety regulations in place, and also wherever required we have provided the halal certification as per the need of the patients. So sir, the managing director Mr. Lalit Vadavan, he is the one. I am director Mr. Dipin Verma, and Vijay Dubey is my colleague. We three of us started the company in 2014, and in the last 10 years, we have sought to become the #1 nutraceutical player, though of course long way to go, but we are moving towards that. In bone and so we focus basically into three segments. The first #1 segment for us is bone and joint, women's health, and lifestyle disorders. So here obviously we'll be discussing about the women's bone and joint segment, and also will help the patients who are in the women's health also. We are a pan-India based company, sir. We can practically be are there in all across the country, right from the north to south and from east to west. Our major presence is there in south, his major presence is there in east, also in the states like Tamil Nadu, West Bengal, Maharashtra, north in Uttar Pradesh, eastern side we are there, in northeastern side we are there in Assam. So in all major states we are present, and we are also, have a very vast distribution network of more than 20 consignee agents, 2 mother depots, and more than 600 stockists. And our medicines are sold at more than 36,000 retailers. We are also available on the online pharmacies. So availability of our brands and products is guaranteed if you prescribe Innovcare product. Sir, as I mentioned that we follow the WHO CGMP standards certification, and our products are of the highest quality standards. As I mentioned, we focus on orthopedics, gynecology, internal medicine, general wellness, diabetology, and supportive health, and also we have a segment called sexual health, which is also very, very important in overall well-being of a patient. Sir, in the orthopedic, we have now brands which are, which are today prescribed by so many of doctors. Thanks to you all, given us the blessings. That EndoShot Pro, InstaActive range, InstaActive OA, also ColaShot C2, LigaShot, InstaFlex range. These are all our range, which is pain management, hardcore drug management, and also supportive care in nutraceuticals. We today are, you can say, are pioneers in introducing these molecules first time in the country. Even in the general wellness category for muscle cramps, and also in the overall sexology portfolio, we have products like T3, T3LC, T3D3, T3 ALA, and T3 Plus. We also have a very good sexual wellness products like E-Drive, E-Drive C, which help the patients in leading a very good quality of life. Our gynec portfolio is also today one of the most admired range, including Inofol HB, Fertilix Ova, Metinofol, Proinofol, and infertility range as well as for gynec range. We today are we have an established player in this segment. Sir, we are the only company which conducts clinical trials on nutraceutical products. What happens is that major pharmaceutical companies have been doing trials on hardcore drug molecules, but very few companies are focusing on doing a clinical research on a nutraceutical product which gives results as good as like a drug. So we have conducted till now 3 trials. Fourth one is undergoing and also will be any time soon results will be out. So Tendoshot Pro we have done a trial, Colashot C2 Plus and also on Ligashot. Fertilix Ova also the trial is going on, which is in the infertility segment. So these results have really encouraged us to do such kind of more studies and give you more insights about how these products work, how these molecules work, and how the combination work together in the management of pain or infertility, or in case of chronic pain like osteoarthritis. Sir, we have been a recipient of industry brand excellence awards. We received it for Colashot C2, the managing director receiving the awards as one of the best launched products brand in the country. We have now introduced the first brand in the country with a non-cannabis source, the InstaActive Fort. We first thought that how the cannabinoid system would react when we bring in something which will work on that particular receptor. So we started our promotion and developed the product, the InstaActive Fort and InstaActive Gel, and we received a very good response on the same, and that has encouraged us to come out with the pure cannabis range. We also brought the first time in India molecule in calcium, calcium lysinate with RichCal Bio, and also we introduced for varicose veins and hemorrhoids brand Beniflex, and also for skin and hair and nails for collagen, that is Colashot Glow. And now we are very pleased to inform you that we have brought in the various formats in medical cannabis in the modern medicine. First being the oil, which is there on your table. You can have a feel of it. The InstaActive patch. Spray is also already been launched, but spray, the main cannabis, it contains beta-carotene, which works on the cannabinoid system, but the oil is a pure cannabis. Patch which is going to come is going to be a pure cannabis from a leaf extract, not from the flower. Let me tell you very straightforward. And also we are coming with an InstaActive Emul Gel that is also going to be very, very helpful in the management of pain. This one product which we have also going to introduce is InstaActive Cough Syrup in the respiratory segment. This is just to keep you informed that it also has a very good role in the respiratory segment. Sir, welcome, sir. So that is also in our pipeline, and soon the product will be in the market, sir. Sir, we intend to spread our brands across the country, and we believe that more and more patients should try our products, and therefore our T3 group, with your blessings, have become now 25 crore brand. Colashot group has become 15 crore brand. Tendoshot group has become a 15 crore brand, and soon now this InstaActive group, which is right now 10 crore, but soon will cross 20 crores, with your support and with your encouragement, and with such a innovative molecule that we are launching. E-Drive also has crossed, and EFM, both women's health brands have crossed now 5 CR brands. So this is just an overview about InnovCare, and we always feel that InnovCare is our pride, and our endeavor is to give you such innovative products which will help your patients to relieve pain and solve the chronic problems, and you can help them lead a good quality of life. Thank you so much, sir, for patient listening. And now I will invite Dr. Bijoy Dev to take the session forward.
Good evening, everybody. See, I would like to welcome all of you for attending this advisory board meeting. Thank you for your time and expertise and willingness to collaborate with us. And today's discussion basically on cannabis, because nowadays in the pain management, we are facing a lot of problems, whichever the conventional medications we have. So we would like to explore cannabis, how it can help us and take it forward further. Now, this advisory board, why this advisory board is required? It is basically a structure and compliant forum for clinical discussion. And particularly purpose of this particular advisory board is to gather insight from all of you and align the strategies with the real world needs. Now, I would like to tell you that insight, whatever we'll be getting from this particular discussion, it will be published in the index journal. The first one is that it will be published in the form of letter to the editor, which will be published in the first page of journal. Second one is as a medical bulletin in the medical news category. And the third one is as a review articles. It can be published in the Indian Journal of Orthopedics as well as International Journal of Orthopedics. Now coming to this ad board meeting, I would like to tell you that here major problem is your pain remains a major quality of life issue. Now the conventional therapy has a shortcomings. Even also there is a problem with the tolerability. Now I would like to tell you a little bit that we have a non-selective COX-2 inhibitor as well as selective COX-2 inhibitor. When we go for non-selective COX-2 inhibitor, we have a problem of GI irritation, nephrotoxicity, even also problem in the coagulation of blood. But when we think about the selective COX-2 inhibitor, yes, it doesn't have all those problems, but major problem is the QT interval prolongations we have come across, and for that purpose, there is a cardiac arrhythmia. In the past, you have seen that there is a rofecoxib, valdecoxib. It has been withdrawn from the market because of that. Now, there are two selective COX-2 inhibitors still available in Indian market. One is etoricoxib, another one is palmicoxib. Both are under scanner. Now, if we come to the opioid derivatives, yes, it gives very good relief from pain, but major problem is the respiratory depression. Even also, we like to go for the opioid derivatives like tapentadol or there also we face a problem that is severe vertigo, nausea and vomiting. So there is a tolerability problem, side effects. So at this juncture, basically we would like to explore the cannabis and cannabinoids can fill this gap and it gives better result, whereas without any side effects. So this objective of this particular meeting is to explore the clinical data of medical cannabis. And here we would like to take your opinion that how it can be taken forward with the clinical trials, even also patient educations and other aspects. So in a nutshell, if I tell that chronic pain remains a burden, so innovation is required. Now here the cannabis offers a really very good result, but still it is debatable. Today we'll discuss at length that even also it gives very good efficacy, particularly in case of chronic pain. Not only chronic pain, also acute pain also it's very effective. Still it has not been legalized in most of the country. What is the reason for the same? We'll explore these things and we will come to a conclusion how we can take this particular cannabis in future and further development. Thank you. Let's lead the future of pain together. Thank you. Now, I would like to invite Dr. C.T. Alagappan. The topic is the role of cannabis sativa in chronic management and its significance. Dr. C.T. Alagappan is a MS in general surgery as well as he is also an orthopedic surgeon. So he is the senior consultant orthopedic surgeon in Chennai.
you want to change. This- Dear friends, I thank you for being here today. We are here to discuss the role of cannabis sativa in chronic pain management and significance. Is a natural alternative for chronic pain relief. A topic that has moved from the shadows of controversy to medical research. Chronic pain is prevalent and debilitating condition, as the previous speaker was telling you. Chronic pain is very difficult to treat, and conventional treatments include opioids like oxycodone and fentanyl, codeine, etc., and NSAIDs and antidepressants. You know the side effects of all these medicines like NSAIDs and opioids. So we have to look for something that will take care of the chronic pain in the long run. And in Indian Journal of Orthopedics says there are 22 to 39% of people suffering from rheumatoid arthritis and osteoarthritis. And emerging interest in alternative therapy is a cannabis sativa. What is cannabis sativa? Cannabis sativa is a species of cannabis plant. In Tamil they call it Kanja sativa. Kanja. Have you heard of that? That's called Kanja in Tamil. And it is a marijuana. Some people call it a marijuana. We think it is a very dangerous thing and being controlled by the government. It is everywhere. Everywhere it is controlled. Even here it is controlled. Whether you procure, whether you extract, whether you sell, everything is accounted. The cannabis sativa is a species of cannabis plant. Contains active compounds like cannabinoids. They are THC and CBD. And get into that expansion and all that is very difficult and confusing. Only Dr. Can explain, the company doctor can explain to us about all that. Also contains terpenes and flavonoids. They contain terpenes, and you know what a terpenes is. Terpenes, to give you an example, is what it gives aroma to a flavor, a flower, aroma to a leaf. All that is what is called terpenes. Flavonoids, you all know, antioxidants and anti-inflammatory. Key cannabinoids are CBD and DHC. The THC is the one that is psychoactive and CBD is non-psychoactive. The THC and CBD concentration is in various parts of the plant is shown, but mainly it is a leaf that is used to extract and then use it for the medicinal use. The composed CB1 and CB2 receptors in the body we have. CB1 is the central nervous system. CB2 is peripheral tissues and immune cells. This regulates pain, inflammation and immune responses. Sorry. Cannabis activates CB1 and CB2 receptors, reduces pain perception, modulates neurotransmitter release, decreases inflammation and oxidative stress. This is the mechanism of pain relief in that. I am not going into the details of that. The medical benefits are the CBD is in anxiety, depression, inflammation, inflammatory bowel disease, migraine, nausea, pain and psychosis and seizures. THC is good for anxiety, glaucoma, insomnia, low appetite, muscle spasticity, nausea and pain. You will see the leaf in all the slides because the concentration and whatever is taken is only from the leaves, not from the root or stem or the flower. Am I right, sir? Yes. This supported the neuropathic pain. We are very it supports neuropathic pain, fibromyalgia. You know, we all examine some patients when they complain of pain. We cannot locate anything. And we do many investigations. Even then we find it very difficult. In such cases, we diagnose fibromyalgia and this will work better on them. And that will relieve the pain. And also musculoskeletal related pain. People coming with low back pain without any, whatever, we cannot make out any reason for the pain. And also rheumatoid arthritis. But in rheumatoid arthritis, the early arthritis maybe, but when the deformities are developed and all that, it may not be very helpful at that time. The cannabis versus opiates, we have been using opiates, you all know about it. Less risk of dependency. No lethal overdose, effective for neuropathic pain and inflammatory pain. The medical cannabis products that are available now, oil, tinctures, capsules, ebibles, topical creams and vapes, but some of them are marketed, some of them not. Patches are not available. The side effects: dry mouth, dizziness, fatigue. The THC can cause euphoria, anxiety, cognitive impairment. CBD is well tolerated. Tolerance develops over time. In conclusion, it's a promising option for chronic pain. Multimodal mechanism, low dependency. Ongoing research and policy evolution. Thank you very much.
Now I would like to ask our audience if you have any questions that we can discuss, or otherwise we'll proceed further for the next conference. Any question, anything anybody has at the back of the mind? Because here we found that cannabis are not used particularly in our daily practice, and it's an absolutely new concept. Because
have you got any special permission for using this cannabis thing? Because everywhere it is illegal using here, getting it here itself. How you are getting it? How you are?
Right. This is a very valid question because legal aspect is the most important because we know the efficacy. There is no question of efficacy and even also regarding the side effects. The first of all, this cannabis sativa only leaves and seed, it has been approved. Neither your flowers nor roots. Okay. Second one is cannabis indica has not been approved because in case of cannabis indica, you have to take the whole plants. Now, in case of your Ayurvedic proprietary medicine, it has been approved, but they have kept it in Schedule E1, not in Schedule 4. That means they have exempted from your narcotics. Only the leaves and your seeds. But other parts of the plant, it is not being exempted. Here you will find the extract, it has been taken from your cannabis sativa leaves. Second one is that how does it give the pain relief? Now, when we take this extract from the cannabis, there are hundreds cannabinoids. Out of 100 cannabinoids, two are the major. One is THC, another one is CBD, sir has told. Now, if you take into consideration, THC has a psychoactive effect, but CBD does not have the psychoactive effect. Now, if you see our endocannabinoid system, it is made of CV1 and CV2 receptor. CV1 receptor, sir has told that it is found in the brain and spinal cord, and CV2 receptor you will find at the periphery. So when we take this cannabis extract, particularly it activates, if we have THC and CBD both, then THC will act on CV1 and CV2 receptor both. Whereas if there is a CBD only, it will act on CV2 receptor. It doesn't have much effect on CV1 receptor. So you will find the psychoactive effect when you will find that is because of THC. So there also the government has given a restriction that it will be 1:2 ratio. That means if there is a THC, that would be 1 part, but 2 parts will be your CBD. So in case of chronic pain, CBD concentration will be more as compared to your THC. But if it is being used, I would like to tell you, chronic pain, side by side, they have also given the approval in case of your epilepsy, even also depression. So in case of depression and epilepsy, your THC concentration will be higher as compared to CBD. But when we are going for chronic pain, CBD concentration is more than THC.
Like, are you exporting it or you're growing it?
No, see, here in India, only one particular manufacturing unit has got the approval from Government of India. That is in Indore. That is your particularly Mehta Ayurvedic Shangstan. Mehta Ayurvedic Shangstan, they are getting these cannabis leaves in a quota basis from the government. Okay. Now, it has been only approved for medicinal purpose, not for recreational purpose. So, when they are making the finished product, either oil or gel or spray or capsule or gummies or patches, they have to keep all the records, and these records they have to submit to the excise. That means that whatever quota they have received, it has been completely utilized for the medicinal purpose. It has not been used for the recreational purpose. Okay. And particularly your distributor or retailer, they do not have to keep any documentations, because documentations directly it is going for your manufacturer to the excise. Even also marketer, there no need this all records, because the records is directly it is going from the manufacturer. Thank you. So next, I would like to call Dr. Parthasarathi, KP, particularly the role of medical cannabis in chronic pain management.
Good evening all. So this is about chronic pain, almost like 20% of 20% of the adult population global, they suffer from pain, and almost every year there's 10% addition to that. So that is how the chronic pain situation is. And most of us, we try to use painkillers, like Professor Alagappan was saying, even we use NSAIDs and then paracetamol and opioids. So they are all habit forming, or sometimes they also cause a lot of side effects for the patient. So this is one particular branch of medicine where the natural product is used for medicinal purposes, though it is used also for recreative purposes, and then earlier days it used to be used for even spirituality. So this is about 12,000 years old, and it was first found in Central Asian regions, and it spread all over. And it is said one of the Portuguese travelers came to India and has mentioned about the availability of cannabis in India, and it has been also recorded in history in Egypt, the availability of cannabis in Egypt. And in North India it is called as bhang, and we have several names to it. So it's a global burden. Pain is a global burden. Limitations are conventional analgesics, and why cannabis? This is the question that we are going to find out. So the cannabis sativas, cannabis indica, and then you also have a hybrid strain of cannabis. So there are two of them, THC and CBD, tetrahydrocannabinol, that is a psychoactive component of cannabis, and also CBD, cannabidiol, is a non-psychoactive, and most of it is available in different forms, and the cannabinoids which are CBG, CBC, CBN. So these are all names I think are new to all of us. CBG is supposed to be called cannabigerol, a non-psychoactive cannabinoid found in cannabis, has emerged as a promising therapeutic agent with diverse range of potential applications. Then the next one is CBC, it is cannabichrome, and then also we have something called we also have something called CBN. So these are the different cannabinoids which are available, and the endocannabinoid system. This is a system which contains two receptors, CB1 and CB2 receptors. These are CB1 receptor is one of the most abundant in G protein coupled receptors, and CB2 is available in the immune system, bone, spleen, skin, liver, bone marrow, pancreas, and the role in modulating pain, inflammation, mood. These are the ways of endocannabinoid system, how it works. Availability of cannabis. In the inhalation format it is available, route of administration is pulmonary. The onset of action is 5 to 10 minutes, and the duration of action is 2 to 4 hours. Oral, it is gastrointestinal route of administration, and onset time is 30 to 90 minutes, and duration of action is about 4 to 8 hours. Sublingual, mucosal through the mouth, under the tongue, and it takes about 15 to 45 minutes of onset time, and then duration is 4 to 6 hours. Topical, that is what we are now into. Dermal varies and localized. Transdermal patch, that is what again InnoCare is trying to is developed, and then patches are going to be available here. And role in acute pain. There is cannabinoids have a complex role in acute pain management, and which evidence suggesting potential benefits but also limitations of potential risk. So there is limited evidence compared to chronic pain. Effective in certain post-operative or trauma-related pain. Inhalation and sublingual routes preferred for quick relief. Combination with opioids may reduce opioid dose. So role in chronic pain. Chronic pain, as you all know, is a complex and debilitating condition that affects millions of people worldwide, significantly compromising their quality of life. So there is a strong evidence base, and the conditions for which this can be used: neuropathic pain, fibromyalgia, multiple sclerosis, cancer pain, arthritis, and then oral and transdermal formats are ideal for sustained relief, may reduce reliance on NSAIDs and opioids. So the current medical applications, CBD or cannabidiol, has shown promise as an adjunctive treatment for certain types of epilepsy. They are some of them Lennox-Gastaut syndrome and Dravet syndrome. These are all neurologists' domain. And then it's also used for chronic pain management, opioid substitution, and cannabidiol in epilepsy treatment. Emerging evidence in post-traumatic stress disorder, PTSD, anxiety, Parkinson's, and cancer-related symptoms. So we have, it's presumed that when ingested or inhaled, tetrahydrocannabinol and cannabidiol binds to specific receptors on the brain and nerve cells, which slows pain impulses and eases discomfort. They also may provide anti-inflammatory effects, which may help reduce pain. So through inhalation or smoking or vaping, rapid onset, useful for breakthrough pain. Pros are quick relief, self-titration. The cons are respiratory tissues, short duration, vaping preferred over smoking. The weed. There are three types of weed: cannabis sativa, cannabis indica, and there is a hybrid variety also. So this is in the form of oral forms, capsules, oils, edibles. Ideal for chronic conditions. Pros are long duration, easy dosing. Cons are delayed onset, variable absorption, and first pass metabolism reduces bioavailability. Then there is the sublingual tinctures and sprays, medium onset and duration, direct absorption to bloodstream, good for breakthrough or mild persistent pain. You have the topical application that I think that's what we are discussing about. The cannabidiol is used and it does not enter the bloodstream. So they are available in forms of creams, balms, lotions, oils, and localized relief, joint pain, arthritis, no psychoactive effect because the THC part of it is less. So that is why no psychoactive effect. And I think doctor was mentioning about the ratio between the products and minimal systemic absorption. And transdermal patches, I think they have come out with. They are constant cannabinoid delivery, avoids peaks and troughs. Pros are steady state, easy compliance, and cons are slow onset and cost. I think it comes in patches of 25 milligrams, if I'm correct. Okay. 25 milligrams twice daily. Okay. Then dosing and titration: start low, go slow principle, individualized approach. Consider THC is to CBD ratio, CBD dominant, so that the pain and anti-inflammatory effect is more and less of psychoactive effect. Balanced, better for neuropathic pain, inflammatory pain, monitor side effects. And comparison with conventional analgesics. So features of anti-inflammatory features, cannabis has better anti-inflammatory features. Though NSAIDs have better anti-inflammatory features, they have the side effect profile which is high. Opioids do not have any much effect. Analgesic potency, cannabis has got a good effect. NSAIDs have similar effects. Opioids have better effect, but then you have lot of dependency and then other side effects of opioids. The side effects moderate in case of cannabis, NSAIDs, GI and renal, and opioid dependence and respiratory depression. Dependency risk is moderate with THC, and NSAIDs are low, opioids are high. So patient-centric considerations: education and informed consent, choice of format based on pain type and duration, patient preferences, comorbidities, monitoring and follow-up essential. Now this is a spectrum medicine that the products that they have come out with cannabis CB1 and CB2 receptor activating products. They are pain relief oil, they have pain relief patches and Instactive Forte already in the market. They have the spray and then they have the emulgel and the gel. Thank you.
Thank you, Doctor, for your presentations. Now, any questions, anything particularly based on these presentations, we can discuss. Otherwise, we'll go for the next speaker. Any questions?
What is the significance of this slide with monkeys? They eat that and I will let you know
But one thing I would like to tell you that when nobody has asked this question, it stimulates CB2 receptor. How it will relieve the pain? When CB2 receptor is stimulated, two cytokines production will be reduced. One is interleukin 6, another one is TNF alpha. Because of that, the pain will be relieved. Not only that, when it will stimulate your CB2 receptor, the activation of NFKV will be reduced. And we all of us know that once this NFKV will be stimulated or activated, there will be a further formations of your interleukin 6 and TNF alpha. So that's why it reduces. And THC already, sir, has explained that it will stop the nerve impulses to the brain. Okay. Dr. Karthik Reddy is a MS DNB in ortho, and he has also done the FIGR from Germany. Thank you, doctor. You can start now.
Good evening, everyone. So today we'll discuss about the recent clinical trials that are done on medical cannabis. So I think all this has been already discussed by the previous speakers. So main active constituents of this leaf extract, phytocannabinoids, and most important for us is I think CBD and THC. And we have other terpenoids, flavonoids, alkaloids as well. So mechanism of action we discussed, just now discussed, acts on CB1 and CB2 receptors and modulate pain, reduce local inflammation, and also improve peripheral nerve function. Right, and topical application avoids psychoactive effects, and it is effective in pain associated with arthritis, neuropathy, and musculoskeletal disorders. Right, then directly we'll discuss about the recent clinical studies that has been done. This is in 2016, where this has been done in Michigan between November 2013 and February 2015. So where they have used this, compared cannabis, medical cannabis with opioid usage, and they have seen that medical cannabis use was associated with 64% decrease in the opioid use, decrease in number and side effects of medication, and also an improved quality of life. So essentially this is medical cannabis is substituting for opioids is what has been mentioned in this study. So it is definitely a very good adjunct pain medicine post-operatively or for the chronic pain as well. And then another study in 2020, this is a randomized double-blind placebo-controlled trial in 29 adults with symptomatic peripheral neuropathy of the lower extremities. So here topical application of the CBD oil in an emu-based oil has been done and applied to effective areas, and control group is placebo emu oil without CBD for 4 weeks. So and the key findings here are pain reduction, and on a neuropathic pain scale improvements were noted in several NPS domains indicating enhanced quality of life, and safety wise no adverse effects were reported, suggesting that topical CBD is very well tolerated with almost zero side effects. Right. Again you can see that mean neuropathic pain scale at 4 weeks pain has significantly reduced with not much side effects. So another study in 2022, this is again a randomized controlled trial of topical CBD for the treatment of basal joint arthritis of the thumb. So basically a proper orthopedic condition which has been studied. So a topical CBD has been applied twice daily for 1 week, and they have studied the results, and this in the single center randomized controlled trial they found out that topical CBD treatment demonstrated significant improvements in thumb basal joint arthritis related pain and disability without any side effects, and also visual analog scale pain, also dash score, that is disabilities of the arm, shoulder, hand, and single assessment numeric evaluation scores, everything has improved, and there were similar physical parameters identified with range of motion, grip, and pinch strength. In the recent study in 2024, again the effect of full spectrum cannabis leaf extract on pain, inflammation, and quality of sleep. Again here the patients were prescribed India's Pain Aid 3000 milligrams full spectrum MC leaf extract basic tincture. So the oil based tincture was given sublingually in this study at night for 1 month, and the initial dose of 5 to 10 drops was gradually reduced owing to pain aids, rapid relief, and anti-inflammatory action. And primary result was 70 to 99% reduction in pain, spasticity, and inflammation. And also all these patients had elevated CRP levels, insomnia, and varying degrees of muscle stiffness at the time of the study. But there are only 5 patients which has been studied in that group, although the number of patients are less in that study group, but it is a good starting point for many more studies to come in future. And this is again 2025, again topical cannabis clinical trial was done to assess the efficacy of hemp seed oil on knee osteoarthritis. So 90 patients were randomly allocated to 3 groups, 30 each. One group got hemp seed oil, the other group got diclofenac gel, and the other group got placebo. And it has been applied for 2 months. And if you see the visual analog scale scores and WOMAC scores, has significantly improved, and I mean the hemp seed oil was as effective as diclofenac gel in this study. And then they have done a study comparing Instac 2 oil along with Dr. Ortho oil, and they have found it is the onset of action is quick and it is equally effective as Dr. Ortho oil, and also time to pain relief and time to complete relief are better in Instac 2 oil compared to Dr. Ortho oil. So, and joint and musculoskeletal pain intensity measured by pain VAS scale, everything is better in Instac 2 oil compared to Dr. Ortho oil. Patient overall pain satisfaction. So conclusion for this particular study, both Instac 2 oil and Dr. Ortho oil demonstrated comparable efficacy in reducing pain and inflammation both at rest and during movement. However, Instac 2 oil exhibited a slightly faster onset of action and was rated higher for ease of spreading, suggesting a more user-friendly application. So topical oil application has very good effects without any side effects. Right. Thank you.
Thank you, Doctor. See, here we have also done another clinical trial. It has been done in India itself, particularly in Chennai. That is CRO, Clinical Research Organization KI3. They have conducted this clinical trial. This clinical trial has been carried out in SRM hospitals. Now, we have got the ethics committee approval. Then after that, it has been registered in CTRI. And we have also notified this DCGI because now it has become mandatory. If it is a Nutra or it's a Ayurveda, or in case of your drug, obviously you have to get the approval from the DCGI, but in case of Nutra and Ayurveda, you have to notify the DCGI that you are doing this clinical trial. Then you have to take the notifications from them, then you can go ahead with this. Now here, this particular clinical trial, it has been compared with Volitragel. Okay. Now, it has been found that particularly VAS and OMEC score, it has been taken into consideration. In both the cases, it has been found it is better than your Volitragel, number one. Number two, onset of action is better than your Volitragel, as well as Volitragel, basically a diclofenac gel. And second thing is that duration of action, that is also better with this cannabis gel. Now, coming to the next. That see, there is an improvement of your VAS and OMAC. Then they have also taken into consideration two inflammatory marker, ESR and C-reactive protein. When these two inflammatory marker it has been taken, it has been found that two inflammatory markers have been improved better with cannabis rather than your Volitragel. So this particular clinical trial will be published very soon in the Index Journal. See, I would like to tell you that in case of oil segment, this Dr. Ortho oil, if you see the total cell overall, that is not being prescribed by the doctor to that extent, but you will find the GP, CPs, they use a lot. Second one is that you will find that OTC segment, if you take into consideration, it has become so popular, the people, they go to the retail shop and they buy it. Yes, obviously it gives a result, otherwise further purchase will not be there. Okay. Now we would like to see that in oil segment, there is no other oil which sells too much. So we would like to see that how much effective this cannabis oil as compared to your Dr. Ortho oil. That's why it has been taken into consideration. It has been taken into consideration seeing the cells of that particular product. It contains your Gaultheria. Gaultheria is nothing but a methyl salicylate. It contains eucalyptus oil. Okay. It contains your camphor. Then it also contains Pinax roxburghi. Then it also contains another substance that is basically Broswellia. I think that you have heard this name, Broswellia serrata. And also it contains your carcinoids. So these are, Broswellia is very, very effective. Particularly, it has a very good effect on HLE, human leukocyte elastase. Not only that, even also it blocks the LOX pathway. So it gives very good relief from pain. Even carcinoids is a selective COX-2 inhibitor, if you take into consideration. So it doesn't have those effects. which we come across in case of drug that is selective COX-2 inhibitor. So that's why. So now. Now I would like to call Dr. V. Soundapan, that is medical cannabis impact on social. What will be the social effect of this cannabis? And Dr. is MBBS, MS in general surgery. Also, he has completed, that is MCH in neurosurgery. He is a neurosurgeon as well as general surgeon too.
Okay. Good evening, everyone. I'll keep my talk brief, and I'm not going to go into the details of cannabinoids and other things. So, weed, why it is called as a weed? Though humans started growing it, domesticated like a domesticated animal started growing it as a crop culture, still it goes out of control and it grows wildly in the general area. So that's why it's called as a weed. Okay, and it requires a plain area where there is no trees, no shadows, nothing. That's why it's grown mostly in Tibet. The oldest recorded history of weed was found in China, where there was a excavation where there was a fireplace, and they found traces of cannabinoid that is around 2,500 years ago. It was widely first grown in, mostly it was found in Tibet, because Tibetan plateau, when the Indian subcontinent started impacting the Himalayas and other things, with the European continent, when it impacted, that Tibet rose. So that became a vast area, plain land, where the wheat grew. It was grown. Then it went to Europe. In 13th century, it went to Africa, and 16th century, it was taken to South Africa, where now the world's most productive country is in South America. And this is all already spoken. And this is the only component which plant which has got which is grown, which was there even before humankind. They say that humans evolved along with this cannabis. Understand? For your question, sir, actually chimpanzees are like as intelligent as humans. They supposed to have found out the use of cannabis, and then that's why they become intelligent like that. And oldest scripture like Rig Veda contains Somabana and Surabana, of which Somabana contains wheat. Of course, the recipe is lost, but still it is there in widely in North. It is available as biscuits, it is available as cake, it is available as, if you go to the western part of India like Jodhpur, Udaipur, you will get as chocolate and biscuits. And if you go to eastern part like Gaya, Kashi, you will get in a liquid form, right? Kashi Maga Prasad. And the gas form is available everywhere, right? So this is the only thing which is used as a solid, liquid, as well as gaseous forms. This is already spoken. Again, so I had a beautiful slides. Like I saw those smoking Shona with this thing, chilium, what they call it, chilium with opioid in the Himalayas in snow, because it numbs the pain, right? And they are exalted so that they feel that they are closer to God. And they say that even Parvati gave to Shiva that cannabis extract to nullify the effect of that poison which he took. So those were the legends, what legends say. And next, you have seen I think everybody would have seen our famous movie Dhammaradam, Jenathaman, where all that's one of the famous songs of those days, 1970s, I think. Hare Rama, Hare Krishna. That, a newer version, Dhammaradam, yeah. where hippies, she'll be along with hippies, then she reform herself. That's a bad social effect of having the recreational this thing. Okay, and bad part, I had a photo of El Chapo. So that fellow, I mean, he used this as commercial purposes, and then finally he landed up in a jail. So what best way we can do? And one more thing about this medical cannabis, which is legalized in Europe as well as in American certain states. It's legalized. After the Vietnam War, the soldiers have gone into a lot of post-traumatic stress disorder, and this cannabis is supposed to have relieved them from that stress disorder. Because if you take the endocannabinoids, the receptors, they are mostly abundant in the brain. That's why it is used for seizures, intractable seizures. That somebody was talking about Janus-Gestalt syndrome. In Janus-Gestalt syndrome, there is a society which communicates with the parents of Janus-Gestalt children. They have a social media, they have interactions. One day there was it's true, male sitting there, today I am very happy. My son was seizure free for 1 minute. So that's the kind of seizures they used to have. Continuously they threw seizures, Janus-Gestalt syndrome. So this is going to be a boon for those kind of intractable seizures. And only in this exogenously cannabinoids, they combine with the endocannabinoids, which are cannabinoids like substances found in our system. This is the only thing which migrates upwards towards the brain and sends impulses, so that either relieving the pain, relieving the depression, relieving the nausea, relieving the seizures. So this kind of advancement is only with this molecule. So what best can we do for the public to avail the benefits of this molecule? First, legalization of medical use, and then wide publicity, avoid pilferage and usage of recreational cannabinoids, and then lot of research has to go into it. And this recreational use we have seen everywhere, and especially during holy season, everybody will be knowing what it causes. And people should know that it's a medicine rather than everything is taken in moderation is a medicine, everything is taken in beyond excess is poison. So we should encourage law enforcement authorities also to engage with the lawmaking authorities to discuss about the possible better positive effects of cannabis, and then legalization should come, and medical use of cannabis should also come into our country. Because the post-traumatic stress disorder is the biggest thing we see, post-traumatic, post-head injury. That's mostly post-head injury, and I have seen a lot of young children there when they suffer. It's very difficult for them. See, they lose their career, they lose their education. So for them, it will be a boon. So naturally, when it's coming in a big way, there will be a lot of demand. So there will be a lot of the leaves are used for the medical use, and the stems are used for extracting fiber and making textiles and paper boards and other things. It has been used. So people in Europe as well as in America, where states they have legalized it, they are reaping benefits by so many, like social security is less and for people, and economy also booming. So people's stress are, they spend a lot of money for the post-traumatic stress. So this kind of thing will help in improving the pain, especially pain. And there is a National Geographic article regarding cannabis revolution. It mentioned about the extracts medicinal use of this thing. So I think I am to the end of this session. Thank you.
Doctor was telling that in case of exogenous and endogenous, in our body there is an endogenous cannabinoids that is called anandamide. Anandamide has also the similar effect. Anandamide also acts on CV1 and CV2 receptor. That doctor would like to mean that, yes, of course. And this exogenous has the similar effect of anandamide. You have rightly said that in India, like Cipla, Lupin, they have come with this synthetic cannabis. Synthetic cannabis, the major problem is the side effect. Efficacy is good enough. Because of the side effects, they are not in a position to tolerate. When so much side effects, yes, your epilepsy it is being used and it will be controlled, but the side effects, the patient is not in a position to tolerate and they stop the medications. Now they are once again coming back to organic cannabis sativa. They would like to take organic cannabis sativa, the extract, and then they would like to develop this injectable as well as oral form. Yes, doctor.
Hi. Hi, good evening everybody. I'm Dr. Vijay Krishnan. I think the most of the subject everyone has cleared it, and just this is a small chapter. This is a new advancement in chronic pain management and the role of beta-carotene. What is beta-carotene? It's a natural bicyclic sesquic that constitute many essential oils, which is most commonly present in cannabis and other non-cannabis plants also, like black pepper, cinnamon, and cloves. And cannabis, which shows a mild psychotic and analgesic effect, but non-cannabis plants, which doesn't show that antipsychotic effect, but it has got excellent analgesic and an anti-inflammatory effect, and which has got no psychoactive activities like cannabis. So, what is the protective effects of beta-carotene in chronic inflammation? So you see beta-carotene, it helps in the visceral fat, decrease the visceral fat index, and decrease the triglycerides level. It is decrease the neuroinflammatory inflammation, and reduce the adipose tissues, and decrease of use of analgesics. And in this beta-carotene is also used in atherosclerotic in coronary artery disease also, and decrease the infarct, and it also decreases the blood glucose levels and plasma insulin levels also. So this is a type 2 selective agonist, okay, which helps in neuroprotective and anti-inflammatory mechanism. Okay, this is a selective agonist for the cannabinoid type 2 receptor, which is also involved in pain and inflammatory pathway. So it is all beta-carotene is all found in essential oils from various plant sources, and it's all it acts as an anti-inflammatory, analgesic, antioxidant, antimicrobial, and it acts as in type 2 receptors also. So these are some of the international journals which has been shown beta-carotene uses, and it has been used in selective type 2 agonist. Some of the journals which has been said, which is role of beta-carotene in chemosensitizers and inhibits the angiogenesis in cancer patients, and it seems to be a promising potential drug in treating cancer too. So long-term intake of beta-carotene is able to decrease pain behaviors in the model repeated inflammatory pain in both males and females, to the greater extent to the males. And these are some of the journals which is associated, and it has been shown that beta carotene has been a very good drug of choice. And I think this is the first company which has got beta carotene and cannabinoids in the market, and I think furthermore companies are yet to win. Come across with this, and this is an so in case of it is also used in fracture pains, neuropathic pains, chronic pain conditions. So they have got in tablet form and ML gel forms. Okay, and that's it. Nothing else to say. Thank you. And thank you. Thank you.
Right, sir. So I think there was one query which came up regarding the legalization. So I thought that since as a co-founder, the co-owner of the company, I think I should highlight on this aspect. Because as a company, obviously, we would like to introduce a product which is absolutely legal, okay, and we follow all the guidelines as directed by the Ministry of Ayush, okay, so under the Health and FDA. So we have already spoken about as far as the psychoactive part and the non-psychoactive part, and it's the legalization. So and it's been used in the epilepsy, and of course not recommended for recreational purposes. It has also been used in the industrial purposes, okay, industrial purposes. There it has been used, like textiles is one of the major area where it's being used currently. Though of course we are not directly concerned with that. It all started way back. I think sir was already mentioning about it, that in the 18th century, 19th century, that it all started. And in the last century it got legalized, and also in the 21st century rather, I would say that it basically got legalized in the many states in United States of America. So that and also in Europe it has now been is legal in many countries, and there are cannabis stores there. In fact, in India also, it's not there in Chennai, but it's there in one in Bangalore, and one cannabis store is there in the north also. So so that is also, so in India also it's now coming up. So very soon you will find that this will become more. And right now there are few gray areas, because people are not aware that the leaves are permitted, at the same time flowers are not permitted. So those kind of issues are there. In our pack we clearly mention it is a leaf extract. Okay, in a pack we clearly mention it's a leaf extract. It's a drug which is it's under Schedule E1. Okay, which is so that E1 means that it is a special category, but it does not come under narcotics. Okay, so there is a special license used for narcotics, as NDPS license. So the retailer or the wholesaler or in a pharmacy doesn't need a special, even though they have it. But for this selling this product, they do not need it. Okay, so just wanted to clear it that if you are using a patch or you are using an oil, so you don't need a special license to dispense it or to use it in your patients. So that is why I wanted to emphasize on this aspect. And now of course the various laws are being getting enacted in the various countries in USA, Japan, India, Europe and Canada, okay, where it's getting, in India we have an NDPS Act already. But as I mentioned, that NDPS Act we do not come under this, we come under Ayush category, and in Ayush category this is approved, and this is approved as a leaf extract, we can use it, and on our pack also it is very clearly mentioned. And right now, as I said, as far as the usage in the pain management is concerned, we are only bringing out with the oil, with the Emulgel form and in a patch form, which is transdermal patch, so which is more of a localized application. So overall, there is absolutely no use, no issue as far as in using this product in India, in Chennai, in Tamil Nadu. And let me also tell you that this comes under the various state laws. The state laws, because if a Tamil Nadu has a particular law, maybe Karnataka might have a different law, Maharashtra would have another law. So, but we need to see that what law we fall under. So we have checked the state laws when we are launching this product, and we have found that it can be freely be sold and dispensed and used in the patients in the state of Tamil Nadu. Okay, so absolutely there is no problem in that. Okay, so I know that legalization is a complex issue, required a balanced approach. Medical potential is significant, but must be accompanied by a regulation. Social, economic and legal frameworks must evolve together. So it's an evolving thing, but at the same time, as I said, under the current laws centrally as well as state level, we are absolutely following this law, and we are no way violating it, and it's very much legal. And so therefore no need to worry as far as the prescription of InstaActive oil is concerned, or InstaActive patch is concerned, or InstaActive gel is concerned. We have also brought that InstaActive's 4th tablet, which is a beta carotene, which is not a cannabis. So absolutely the oral form is not a cannabis, okay, but it has an effect on endocannabinoid system. So one need not to worry as when we've taken orally. The spray form works equally well as good as cannabis oil. But because many people do not like to use an oil, so they would like to use a spray form. So we are offering the spray form, which is very, very effective. Okay. So while concluding, I would say that please use InstaActive range, this kind of medical cannabis, which we have today. You all have given various insights on the usage part in the pain management, and I'm sure we all would have got a lot of more knowledge on this aspects, and definitely we will be trying in your patients in the coming days. Okay. So with this, thank you very much, sir. And before I close the session, I would request my colleague, Mr. Kannan, to please come and give his concluding remarks, and also we have some mementos and pleasantries that we need to exchange before we close. So I request Mr. Kannan to take over the session.
Thank you, sir.
Thanks.
So, good evening, sir. I know, sir, the session was very little lengthy. I was expecting it should be over by little quicker, because I know it was got disturbed due to travel, most of the doctors due to the rain and other things. So it is immense pleasure to stand before all to address vote of thanks. And InnoCare also extends a sincere gratitude to all doctors who are presented here for a valuable presentation what you have made to us. Secondly, sir, InnoCare also recognize the immense demand of your valuable times, your experience, and secondly, willing to share your comments on the in form of presentation. And sir, we are grateful for the presentation and new avenues where patient has to be taken care by your guidance, what you have given today, which has got extended exchange between various doctor level. And thanks for all doctors who have a valuable contribution, and I request your valuable collaboration in future also with our products and with InnoCare Life Sciences. So we request you to complete this session with small memento to the doctors who are presented in the session. So I request Dipit sir to honor Dr. C.T. Alagappan with Momento, who is our chief guest as well as a presenter, sir. Sir, I invite Dr. Parsadi KP to honor by our Dr. Bijay Dibbe. I request Mr. Harish Mehta to honor Dr. Karthik Reddy for his presentation. Mr. Pankaj Agarwal to honor Dr. Saudappan. And Mr. Pradeep to honor Dr. Vijay Krishna. So with this note, sir, I like to close the session. Dinner is open, sir. Kindly continue for available dinner.
Thank you so much.
Thank you so much, sir. Sir, we have to
Sir, we have some drinks here, so please have your drink here, and then for the dinner we'll be going down to a restaurant. Okay, yeah, restaurant on the right, on the lobby level. Okay, but I would request that please have your first the